What is going on, everyone? This is Dr. Josh Funk, and you are listening to the Strength and Knowledge Podcast. What's up, everybody? I'm here with Baggy Shorts Baker, a.k.a. Uncle Baker, a.k.a. Dr. Zach Baker. We were actually talking about this particular topic right before jumping on and putting the headphones on. It is navigating patient symptoms in situations where things just aren't going your way. And I know it's hard to imagine. You've spent a ton of time, energy, and money to become a really good clinician, whether through school, through Con Ed courses, through your own practice. But let's be honest, sometimes things just don't go your way. So, Zach, I know you have 3 big keys that you want to share for the audience. They're quick hitters. And potentially this will create a little bit more conversation offline between you and other individuals. But I do think that there are 3 keys that everybody should hear. So let it rip.
Definitely. And this is something that I dealt with early in my career throughout the first several years, and something now 11 years into my career I still deal with. I think what I'm beginning to get is, though, more comfortable with handling these interactions and figuring out what's the best way to navigate moving forward. So, bringing back to the question that was brought up is, how do you navigate patient care when symptoms persist or they're not really making the changes that you expected them to make early on? And I think the first thing that you really need to sit back and reflect and ask yourself is, am I actually treating what I think I'm treating? Did I accurately identify and diagnose what this condition is, or does this warrant us going back and maybe reassessing, asking clarity on more questions, or doing a little bit more testing to really refine how we're allocating time and effort? So number one, make sure you're treating what you thought you were originally treating, and you don't need to get more clarification there. Number 2, I think you also need to get more comfortable with, and this is going to be something as you get more reps and more exposure, you'll get more comfortable with, but do I expect changes to happen immediately? Or is this going to be something that is going to take several sessions or several weeks to accomplish? And I think that's something where communicating that to the patient early on, what your expectations are, go a very long way in regards to calming them down and calming yourself down. If somebody's had chronic pain for 3, 4, 5, 6 years, I don't think showing them that one magic mobility move or that one magic movement modification is going to drastically alter their symptom profile overnight. It may, and that's great, but it may take a little bit of time to build up some positive effects. And then third, and I think this is where we can all get better at, is know when to tag out. And just know when maybe you're in over your head with who you're dealing with, meaning maybe it's something that you don't have a lot of experience or exposure to, or it's just something, for whatever reason, you don't feel comfortable with it. And knowing, who else do I have on my team that's an ally that maybe I can co-treat? And maybe I see this person, they're coming in twice a week. I see them one day a week. They see one of my colleagues the other day of the week, and we get to brainstorm and collaborate. Or when do you hit a point in their plan of care where you feel like you're just treading water and you're not making progress, and you think a different set of eyes would be warranted? And if you don't have somebody in your clinic that can fill that role, or you've exhausted that role, then you may need to go a step further and figure out, is there another healthcare professional that would be more appropriate, or is there just somebody else I know in the general area that I can collaborate with this on? So those are my 3 key things. Obviously, every individual and every case is going to have their own unique set of circumstances, but check off those 3 boxes, and I think you'll at least be in a more comfortable state of mind.
Thanks, Zach. Quick hitting episode for everybody, and definitely feel free to stay tuned for the next episode of the Strength and Knowledge Podcast. Thank you for listening to the Strength and Knowledge Podcast. If you enjoyed this episode or have been tuned in for multiple episodes, we would love for you to subscribe, rate, and give us a review on Apple Podcast or Spotify. Until next time, thanks for listening.